110. And I'll be serving as your facilitator again today for our meeting. The Oversight and Accountability Council welcomes and encourages community input. Members of the public are invited to submit public comments by emailing oha.measure110@dhsoha.state.or.us. And that email address and more info about the council can be found on the Measure 110 OAC website. For more info or support with community engagement, you can always contact Randy Hemsley at OHA. So before we get into today's agenda, I just want to take a moment to recognize how you have continued to show up and share space with each other week after week. Folks speak their truth, and we're building together as a group what it means to honor that practice. Your tri-chairs and I have discussed ways to highlight the importance of every member on this council. And one way we've discussed doing that is to make space when folks feel moved to share that they've been harmed or felt harmed, or to point out a growth edge for the group. So please know that you each individually are invited to reach out to any of the tri-chairs that you're comfortable reaching out to when you have any concerns or feel as though you may not be fully seen in the space. So for the work today, you will continue to look at the contracting and granting process and talk about next steps for the work in the coming months. All of your tri-chairs are with you today, and Sabrina will lead today's meeting. So I'll hand it off to her. Thanks, Sabrina.
Thank you, Roberta, and welcome everybody. So today for the agenda, we're going to talk about the RFP, RFGP process, and Angela Carter is going to speak to that. We're also going to have some of the subcommittee discussion, and Ron will discuss that a little bit more. And then finally, we're going to have the rules process and RAC membership, and Colleen Needham's going to share that. But first, we had some feedback regarding last week's meeting, and some of the language that was used came across harmful, and we would like to open the floor to see how that made us feel as a council. So we'd like to have a space to talk about that right now. And I leave the floor open for that. And Ron and Keisha, if you have any, okay, yeah, thank you, Blue.
I can't find my hand raised feature. I had actually written up something to say, and I was just going to check in with you, Sabrina, if you feel like it would be better to just give a little bit more time to see if other people want to have a discussion before I sort of say what's been on my mind, or if you think it would be appropriate to do that now. I
think it would be appropriate for you to do that now, Blue.
Okay. So I'm not very good at this, but bear with me. I really appreciate the opportunity to have these discussions with other council members, and also obviously to share our work that we're doing with everybody who's watching these meetings. It's important for me to share part of my personal story. I appreciate other council members like Amy and Onisha and Morgan, who have also shared a lot of their stories to really let us know what it's like for different people. I would like to address the dismissal of people who use drugs from meaningful engagement, and also what I feel is the erasure of the work of people who use drugs. I'm just here to speak about my own experience, but I also want to acknowledge that I am standing on the shoulders of giants. I'm here to speak for the people who have died along the way and can't tell their stories anymore. As a survivor, I feel like it is my duty to share these stories with you. I started working in harm reduction in 1992 after I found a book that was called Drug Prohibition and the Conscience of Nations. And it talked about, the history of harm reduction and how prohibition and criminalization was killing people. And that book changed my life. That is also where I really got a good understanding of what harm reduction was, and where I learned about the history of it. Harm reduction was started by and for people who use drugs. And it's important that that is not erased. There was a group that was a drug users union in the Netherlands called Junkie Bond, and they started essentially the first syringe exchange in response to hepatitis B infections. Shortly after starting their exchange, they also were dealing with HIV infections rising. There was a large scale harm reduction program in Mersey in the United Kingdom that was modeled after Junkie Bond, and often the Mersey model of harm reduction is talked about as though it was the first program that was started through public health, and that's not accurate. Harm reduction activism and HIV activism in the United States was really intertwined when I was doing this work and starting in the 90s. It was grassroots, and we had to fight to save ourselves because nobody cared that we were dying. Public health has been very slow to get on board and come forward and help people who use drugs and other people who are affected by HIV. I also want to say that HIV activism would not have been the same without the support and the involvement of communities of color, people who use drugs, and the queer community. And I don't want any of the work of those communities to be erased either. And as a Latinx queer woman, I don't want my work to be erased either. People who use drugs are still fighting for harm reduction. We wouldn't have programs distributing naloxone without Dan Bigg from the Chicago Recovery Alliance, who freely gave away naloxone before there were laws or policies that allowed him to do so. He did it because people were dying. I work in public health. I love public health, but I also want to acknowledge that public health has still been very slow to support harm reduction and give people the tools that they need to save their own lives. There are some public health departments that still don't support harm reduction or have harm reduction programs, despite years of data showing that it's an effective strategy. People are still dying preventable deaths because their lives are not seen as valuable compared to people who don't use drugs. I am grateful that I work in public health and that my program embraces it because it aligns with harm reduction, aligns with public health goals. But I also acknowledge that we could be doing so much more to help people who use drugs stay alive, including opening overdose prevention sites. I want people who use drugs, who watch this meeting, who live in Oregon to feel seen and heard. And I don't want to be complicit to the erasure of the work that people who use drugs have done. It is my hope that the council will consider finding ways to bring more people who actively use drugs to the table to help create the programs, policies, and grants meant to help them. Thank you.
Thank you, Blue. Thank you for sharing your truth and your insight with us. Sabrina?
I would just like to leave it open to see if anybody else had anything to say before we moved on to our next agenda item. And I would like to also say thank you, Blue, for being very vulnerable in this space with us. We appreciate all your feedback and your presence amongst the council.
Yes, I'd like to echo my appreciation for Blue being vulnerable in the space and sharing her truth and coming forward and expressing herself in such a powerful and meaningful way. And I just want to acknowledge and appreciate you for that, and acknowledge that and acknowledge you. So thank you very much.
If nobody has anything else, I would like to go to the next agenda item. And that will be with Angela Carter, the Measure 110 manager from OHA, and she'll be here to talk to us about the RFP/RFGP process, and they will share some sample language with us. Angela, thank you.
Hi, everyone. Thanks for having me on. I appreciate it. So my goal today here is to walk you through some sample language to give you a sense of the timeline that we're working with to get this grant proposal out to the community and get it funded, and to answer questions if you have any. And then also to the recommendation or from the group was that you all would form a subcommittee to build this RFP.
Did we lose Angela? Oh no. Okay. We'll just hang tight till they come back.
Yep.
And Colleen, just checking in with you about the RAC conversation that's coming up. Will you be able to stay for the entire meeting today?
Yeah, I can. Yeah. Thank you.
Yeah, thanks.
I'll be here. Thank you for having me.
Appreciate you. We may have a ton of questions, so you might have to save your thanks. You may not need it by the end of the day.
Happy to try my best at answering them.
Awesome. All right, I'm feeling for Angela now. I hope there's not a computer crash or something going on there. It's the worst.
Does anyone have text with Angela to maybe
I
they
do.
don't?
I
maybe
do.
they
It's a computer crash.
No.
It may take a little bit of time.
How annoying. Oh. Okay.
So maybe we could, I mean, we had a kind of a flow here, but I'm wondering if we could start the conversation about rack structure, broad parameters for who should be involved. Would you guys be okay with that? Colleen, would you be prepared for that?
Yeah, I can be prepared for that.
Okay, so
We did have a little bit of a flow. It'll.
Yeah, can we kind of wait for a few minutes and see if Angela hops back on? It kind of, takes away from the flow.
I'm in agreement to wait for a couple of minutes as well.
okay, I'll be patient.
I'll let them know.
All right, thanks, Alfonso. You keep us posted. All right, and then today,
I'm on the phone, so I can't raise my hand, but
Oh,
can
go
I
ahead,
say
Karen.
something?
yes, go ahead.
Yeah, since we're waiting. I just want to thank Blue for what she said. And if anybody likes to read here in this group, there is a book I've read no less than 3 times now. And I met the author too. He's awesome. Dr. Gabor Mate. There's a book called In the Realm of Hungry Ghosts. And, you know, I've been in this business for 36 years now. It's the best book I've ever read that talks about addiction, substance use, misuse, opioid, harm reduction. It talks about everything. And he weaves in his own personal experience as a medical director of the Insight Clinic in Vancouver. And so I would highly recommend that book to anybody who likes to read and is interested in this topic from multiple perspectives. I just wanted
Karen,
to add that, and I
what's
think
the
it would go
name?
along nicely with, it's the book.
I'll put it in the
called
chat if you tell me again.
Yeah, In the Realm of Hungry Ghosts.
Okay.
And it's a phenomenal book. Thank you.
Thank you. Angela is back with us.
So sorry, folks.
Oh my gosh, you got a computer crash. It's like the worst that could happen on a live Zoom meeting, and you're smiling.
What else can you do?
What
really?
else can you do? I appreciate that. Thank you. Thank you. We'll be patient and gracious. We know you're doing your best, so thank you. Some things are out of your control.
Thank you for your patience. I appreciate it. So to get back to what I was saying, the goals are to give you some information about the timeline here, how long we have to accomplish what we have to accomplish, and by when we need to meet all of those steps. And also to give you a brief overview of some draft language for the RFP, and then to ask if you will form a subcommittee to do this work over the next couple of weeks. So if I may, I'll start off with a timeline. I'm going to share my screen here so that you can all see it. I'm a very visual learner, so I have written out the timeline, and then I also have a Gantt chart, which is basically these are the tasks and this is when we have to do it by. So I'll show you each of those. So, all right, can you see this okay? All right, great.
Yes.
So here is our written timeline. September 5th, today, I am showing you the draft RFP and the timeline, and y'all will get to form a subcommittee. And then the work for the RFP, most of that will go on between now and about September 27th. There's a little wiggle room, but ideally it gets completed in the subcommittee by the 27th. My suggestion would be that the subcommittee meet at least twice, maybe Monday, September 20th and Monday, September 20th or 27th. But that's open to the OAC and the subcommittee to make that decision. Ideally, September 28th, the subcommittee can present the RFP to the full board, go over it, get approval, so that on October 1st, the RFP can be published by the OHA, and the organizations interested in becoming behavioral health resource networks can apply for grant funding. The application would be open October 1st through November 1st to 15th, depending on whether you all want a 4 or a 6-week application period. And then October 1st through December 27th, the OAC will begin to review the grant applications, hopefully as they arrive, so that you all don't end up with a bottleneck of a whole bunch of grants to review at the end of the acceptance period. So on or before December 15th, all grant applications must be submitted to the OHA. I put noon in there as an arbitrary time. We can still figure out when an ideal time for that would be. And then sometime before November 15th, a grants review, either a subcommittee of the full OAC, or if you all choose, the full OAC can convene to start looking at the grants. The grant deliberation needs to happen in public meetings. The grant applications themselves, individual members can take those and check off a rubric, a scoring rubric on their own time, and then bring those to the full meetings. That's totally fine to do that on your own, but the deliberation piece has to be done in a full meeting. All right, and then moving forward, on or before December 27th, the OAC completes the review of all grant applications, and an awards letter needs to go out to all of the organizations that are granted funding before December 31st, on or before December 31st. So there's a little room in there to decide exactly when, but the ORS require that they be done before the end of the year. And then again, on and before January 15th, all of the contracts or grant agreements between the OHA and the organizations creating the burns need to be in places and the funds dispersed. So I will stop sharing and then share a visual document here sort of help explain a little bit better. This is something called a Gantt chart. Basically, over here on the left side, we have all of the different tasks that need to be completed. And then the date that begins, the date that ends. And then we have a visual over here. So here's September 15th. The RFP subcommittee is getting organized sometime in the next couple of days. And then the subcommittee will meet September 20th through the 28th. The final draft of the RFP is here. The draft is approved, and then the RFP is published by the OHA moving out. So this is just a visual organization of exactly what I just said. I won't go through the whole process again. I just wanted to give you a picture of what's happening. So may I open the floor to any questions anyone has about the timeline piece before I jump into the draft RFP?
Yes, Keisha.
So real quick on that, on the first document, it says the subcommittee will present to the OAC the 28th. It's actually the 29th.
The 29th, thank you. Let me fix that.
Thanks,
And I
Keisha.
can, thank you very much. I can share all of these documents with everyone so that you can have something to look at. But I will change this to the 29th.
And yes, Angela, folks have asked for both documents, please, when you
Very
can.
happy to send them out. You got it.
Thank you.
I'll
Blue,
make
go ahead.
sure.
Oh, sorry.
No, and I'll just make sure that they're sent out by the end of the meeting, but after the end of the meeting.
Thank you. All right, Blue, go ahead.
So I guess I just had some concerns about the amount of time we are going to have to discuss, if I'm understanding right, in open meetings, all of these applications. I think some of the other people who were sat in on the last round of reviews may be able to chime in as well, but it took us a very long time to get through like very few applications. And I'm honestly worried that if we use every single council meeting from November 15th through, I think, what was it, the 27th of December, that we might not get through everything. And so I don't know if there's going to be a way to sort of either streamline our discussions or expand our meetings, but I just had a concern around the time that it would take for that piece.
Really good question. I'll frame it this way. There are going to be multiple streams of work that need to happen at the same time, because you all will also be working on finalizing the temporary rules. There will be a few new rules that also need to be put into place in order to fulfill this RFP process. Just a couple around, like, this is the person that you send the grant application to. If you have technical questions, go to this person. Just very basic explanatory pieces. So there's multiple things that need to be happening. One option would be to make a subcommittee and have that subcommittee review the grant applications separately from the full committee meeting, so that the full committee can continue to move forward on the other work that it's doing. Another option would be to work with the full subcommittee, but I hear you that will definitely eat up a decent amount of time. One other thing to consider, the last RFP, I read through a couple of the grants applications that came in and noticed that some of them were quite lengthy, which is wonderful because it provided a lot of information, but also is a little prohibitive because you all have to read through 30 pages to get the information that you need. So another thing to think about is how to streamline the grants process. I'm going to be getting some feedback from the folks who navigated the previous grants process, and hopefully bringing that on to the subcommittee that meets to do this work to integrate into the document. But one option could be to have word limit. You know, we want you to give the answer to this question with 500 words or less, or, you know, 1,000 words, depending on what you think is a reasonable amount, just to keep the number of long applications that you have to go through to a minimum. Just some suggestions, you know, whatever works best for the OAC is great, but just some thoughts. Does that answer your question, Blue?
It does. And I had given some feedback, I think, to Coral about the application, and similar to what you're saying, some other ways that we could streamline, because I also noticed we would ask 3 questions and then have a space to answer those. And some people would only answer 1 question. And so like figuring out, you know, how to break those up or what you can make into like check boxes. Would it be helpful if I sent that to you, or I'm not sure who to send?
I would love it. Yes, that would be great.
And I don't know if can you put your email in the chat when you get a minute?
I would be so happy to. Yeah.
Okay.
Let me
Thank you.
just drop it in there.
All right, giving Angela a second to do that.
There. Oh, that went just to Sabrina. Whoops. Let me copy and paste it to everyone.
All right, Amy is next, and then Ron.
So I'm looking at the timeline that you have on here, and I'm a little, so we're accepting grant applications for this period in October 1st.
That's the ideal. Yes.
And October 1st through the 15th, we're going to accept grant applications.
October 1st through November 15th. If you want a 6-week window.
Oh, okay, then that makes better sense. I was like, oh my gosh.
Yeah, too short, right? Yeah, that's not enough time.
Okay, because I was a little bit confused on that. And then we're still coming up with who they have to submit the grants to and what that looks like, right?
Right, that's a part of the work of the subcommittee to determine all of those things.
Okay, all right. Just wanted to catch up. Thank
No,
you.
yeah,
so
of course. Yes, any clarifying questions are good. Totally happy.
Appreciate you. Thank you.
All right, thanks, Amy. Go ahead, Ron.
No, I was just going to echo what Angela was saying about the length of the responses in the prior RFGB. We didn't put in a minimum or a maximum in terms of the response, and so to provide the applicants with some clarity around that would be great.
Okay, definitely do that. And I see your hand, Sabrina.
Sabrina, yep.
Yes, I had a question, and so I kind of missed this part. So are we going to be going over the applications during the council meetings, and or is it a choice to do it through subcommittee?
That is up to the committee to determine. If you all want it to go to subcommittee, it can go to subcommittee, and I can see a number of benefits for this going to subcommittee so that you can manage to do both pieces, both arms of work at the same time. But it's up to you all what works best for you.
Angela, before we go to Ron, there's a question from Aowen in the chat, and Aowen has a lot of background noise. So that's why she didn't ask it directly. Said you mentioned only burn funding. What is the process for access to care funding?
Access to care is a separate grants process that we have not yet begun to define. It's another important one. We need to get to it pretty soon, but we haven't yet gotten to that place. Did that
I'll give Eowyn a second to ask another question if necessary, a follow-up. Go ahead, Ron.
Oh, in our previous conversations with Wes, my understanding was that both the burn process and the access to care grant processes could happen simultaneously, but we would have to ensure that all the burns were up and running before we began granting, were up and funded before we began funding the access to care grants. That's the way I understood it. But they could, the process could be simultaneous. Folks could be putting in applications for access to care grants, but we would do ensure that and I think that's what the law says, that we would make sure that all the burn applications will be funded first before we began funding the access to care grants. That was my understanding.
Okay, thank you, Ron. Amy?
So yeah, that was a kind of my question. I thought they were, when people were going to submit the grants, they did like last time, I guess they submit for, okay, how can I break this down? So let's say an entity submits a grant application and they're wanting to have a burn or be a part of a burn network, but they also have other areas that this committee was concerned about, like housing, treatment, detox. All those things were inclusive in that grant request for funds. Is that not how we're doing it this time? And so they have to ask for burn funds separate from the other funds that they're asking for, that the burn will be accessing. Does that make sense?
Yes, I think I understand what you're asking. And my understanding, and please, if anyone knows and anything otherwise, please correct me if I'm wrong, but my understanding is that the grants processes are separate. Likely they could use a lot of the same language in each of the grant applications, but the RFPs are separate for access to care and for the burns. That's just my knowledge. If anybody else knows anything different, please feel free to chime in.
Thank you, Angela. We have a question from Dharma in the chat. Dharma, would you like to raise it directly?
Yeah, my understanding was maybe the same as Ron's. Just from reading the text, it seemed to me that we needed to have the burns established before we could fund the access to care grants. And I was just clarifying that, I guess, with OHA more than with Angela specifically.
My understanding is similar, that the access to care grants need to, they can apply at the same time, but the funding for the burns needs to go out before the funding for the access to care grants. So the grants processes may be simultaneous. We may get an RFP together for access to care in a very short order and get that process going as well. But we would not fund any of those grant applications until the burns are established and have received their grant funding.
Thank you. We have a queue of hands. Caroline first and then Keisha. Oh, Angela, do you mind not sharing your screen so we can see everybody?
Oh, I'm so happy to. Yes,
thank you. And if folks want to see that again, just let us know.
Yeah, anything you want up, just let me know. I'll put it up.
Thanks. Caroline, all you.
I lost me. So here I am. So this is a concern because of the fact, I mean, I understand, and I read it that way too, Angela. There's a fact with this Bill 755, the focus is on the burns and then the access to care grants. My concern is the fact that we already gave out some grants. The hardship about getting any type of a grant is the fact that startup takes a lot of time. And some of these awards probably were startup. And if they don't know if they're going to have a continuation, they might have to close down, especially if they put it into positions in FTEs. So I'm not sure how we could assure some of the folks who are ready were successful. If there's some discussion in terms of if anyone's are they monitoring in terms of how well they're doing? Or do they have priority with the new access to care grants that we're going to be awarding? And I think we have to take that all into consideration, because there's nothing worse than having a program open for 4 months, having to compete, not knowing if you're going to have funds, not knowing if you're going to keep your staff, not keeping the staff. And that's always been the danger of grants. And so I think unless we could start creating some base dollars for some of these programs where they could depend on these dollars, I think we need to have some future discussion about that, because it's already September. I don't know where this year went to. I don't know how September is halfway gone when we have so many other things that we need to focus on. So I think we seriously have to consider in terms of if we're going to allow the current grants to have some priority, to give them opportunity. I don't know who's going to be monitoring the grants to see if they're fulfilling their deliverables, but I believe that we need to give them an opportunity to stay on at least for the year of 2022, and that we need to take that in consideration before we start looking at awarding additional grants. That's just a recommendation, something to think about, something to discuss, because burns are completely a whole separate entity, approach, deliverable, whatever we're going to call it. And a lot of the access to care grants that we awarded are not burns, unless they set them up as burns, which I don't know, because I don't think we ever got a summary. We got a list of who got awarded, but we never got a summary in terms of what the deliverables were. I think I'm making a statement. I'm not sure if we could even come up with an answer right now.
I hear you, and it's a really good point. Longevity of the programs that are being funded is really important on multiple levels. And I'm not sure exactly how to codify and make this work yet, but I'll find out.
Okay. Steve, would you like to speak to that? You dropped something in the chat.
Yeah, if I can get off mute. Hi, thanks. Yeah, Carolyn, you raised such an important point, and with the several work streams that this body is responsible for over the next couple of months, I'm also very worried about folks who are currently being funded through prior grants that we have. And one consideration might be to do a basic extension of those grants for perhaps another 6 months while this body helps get the burns up and running and begins to look at the next round of funding. That would assure continuity, give predictability to those grantees who are likely concerned about their ability to maintain their staffing in this. So just an idea.
Thank you.
Thank you.
All right, Keisha, go ahead.
I was just going to say, I thought my understanding for the access to care funding was like the measure 110 is for the things are listed under the burns, like the minimum qualifications and staff and things like that. And the access to care was if they wanted to add like additional worker types or additional services that's not covered under measure 110. But I'm not sure. That's what I thought it was.
Okay, thank you, Keisha. Blue?
Yeah, I am a little fuzzy on access to care, and I don't know if there's a document I should be looking at that breaks it down more clear. I do recall us having some kind of a document or chart. I think maybe Wes made it, that talked about different ways we could set up a burn where it could be one person applies or one group applies to be every aspect of a burn. And another way that a burn could operate is sort of like piecemealing it together with different individual applications. And so I wasn't sure if when we're saying the burn applications or whatever come first, if that is only meaning entire like groups applying together. And the reason that's a concern is just because there are a lot of smaller organizations that are a lot more innovative and culturally appropriate that, you know, they wouldn't be able to provide all of the services within a burn. And, you know, I think it's important that we also consider those and make sure that they are not, you know, at a disadvantage with the way we are setting up these funding opportunities.
Definitely. So in the language of the law and in the language of the draft RFP, I have put in what it says, which is you can apply as a group, you can apply as an individual fulfilling all, or you can apply as an individual with no group, and the OHA will connect you with other people in your area to create a group. So that's my understanding of the way that people can apply and get hooked into other programs. Like if a smaller organization were to apply with some of the services of a burn, the OHA, according to the rules, would then connect them with the other facilities in their network area to create a full burn.
Okay, then I just think I must not understand what an access to care grant is, but I can look at the documents that I've gotten. Thank you.
All right, thank you, Blue. Ron?
No, I was just going to agree with Steve. That idea of an extension sounds really good. I mean, we just kind of got the money out in June, really, and so having kind of a solid year of funding, it sounds like a really great idea for those organizations that are funded. And so, as long as we're having kind of open, transparent conversations about who those organizations are and how we go forward with that, I'm all for that.
Thank you, Ron. And to that point, Morgan dropped something in the chat. Morgan, would you like to jump in here about extensions?
Yeah, it was just exactly that I fully support it because, you know, it just creates such uncertainty in the environment when it comes to hiring and everything. So I just feel like since we're already doing the RFP, there's a way we can use our time more efficiently and pursue those two different RFPs simultaneously, because there will be so much overlap. But just the sort of peace of mind that the ability for an extension will give organizations is great. I fully support that. And yeah, like what Onisha just dropped in the chat is also great. Not just like a blanket extension, but like, hey, what have you been doing? What are you, some follow-up for sure.
Thanks for pointing that out, Morgan. Onisha, do you want to speak to that for folks who can't see the chat? Would you mind? Or Keisha?
Yeah, I was just wondering if just what I asked, if we were going to be asking for a report of the calls that they've already been serving. I'm not 100% sure, but I just want to make, and it doesn't necessarily mean that we don't extend services, but it could probably mean that we ask them to change some things before we extend more financial services, if that makes sense. Like, this is what you're doing is great, but we need to connect you to this program because you weren't connected to another program that is helping you give these services to the best of your ability. Or, are they hiring peer mentors that, fit the criteria of what we've all decided on a macro level in the policy? Like, I would just ask some questions before I extend it and give them the opportunity to weigh in on it. And if they are doing a great job and like 60, 70% of the area say, yeah, we can extend funds, but we need you guys to upgrade in this area, or no, we don't feel like you have a full understanding of the services we're asking you to provide.
Okay,
Thank you.
thank you.
And then Keisha also dropped something in the chat, and then I'll get to you, Aowen and Sabrina and others. Keisha, do you want to share?
Do you want? Oh yeah, I was just thinking about some of the organizations that made it through and really didn't have a real idea of really the funding they were applying for, and so they're doing whatever they want with it, and it's not really in line with Measure 110 and how we are really needing to support these communities with substance use disorder, harm reduction, and things of that nature. They're kind of just doing their own thing.
Okay, thank you. Aowen?
Yeah, I'm struggling with the idea of an extension, and I feel it's a separate conversation that we should have. On the one hand, I absolutely understand the uncertainty that comes with not knowing if the grants funding is going to be continued. I also know that that's the uncertainty that organizations deal with all the time when they are grant funded. And they all knew that when they applied. I'm concerned that the turnaround time for the grant process, the first round, was so fast that a lot of organizations would not have been able to apply. And so we are effectively incentivizing those who either know people so they could jump on the grant process quickly, or have the resources to do that kind of work quickly. And so I have equity concerns about automatically extending funding when organizations that may have had more resources already had an advantage in the earlier grant process. That's part number one. Part number two, I'm hearing a lot of confusion about access to care grants versus burns, exactly what burns are responsible for offering, and what they are responsible for providing referrals to. And it would be really helpful if we could get a very clear reading of the law, perhaps at our next meeting, someone to just say, this is exactly what the obligations are. This is what the burns must do. And I know that it's in the temporary rules, but even when I read the temporary rules, I'm not sure, do you have to offer housing or do you have to refer to housing, for example? So it would be really nice to know exactly what the burns must do, exactly what the access to care grants are for, and that will then perhaps guide us with our decision-making for the future.
Okay, noted, and we will definitely work on making that happen so that there's more clarity in the group.
Thank you, Aowen. Sabrina?
Yes, I had a couple of points. One was about the access to care grants. If we're going to extend it, like Keisha said, I would like to ensure that they were utilizing the funding appropriately. But on the same note, some of the people that were awarded the last part of the RFGP cycle with the 10 million coming in from legislation, they still have yet to receive their funding. So I don't know how we could do a metrics on the services they provided when they have yet to even receive the funding. And then also, if we were going to extend the Measure 110 awardees from the last cycle at any extent, I think it would be a nice reminder to remind them that all Measure 110 awardees must work with other Measure 110 awardees, because I think somehow in translation, and please correct me if I'm wrong, that didn't come across to some people. They weren't quite sure. They thought they had the funding, they could utilize it in the manner that they said they could use it for, without actually respecting the other organizations that were awarded it. I don't know if I verbalized that correctly. So they didn't think there had to be any kind of connection. They thought they could just utilize the funding how they wanted in respect to Measure 110 without any other kind of outsourcing. So I'll just leave it at that. Thank you.
Thanks, Sabrina. Dharma?
Yeah, I have pretty similar concerns as I think Onisha and Keisha raised in the chat, and Sabrina just now too, about maybe how we're getting feedback on how they've spent the funds that have been distributed already. And then to mirror what Aowen shared about the equity piece in that, the extension does seem like an incentivization of organizations that had better access to apply for this first round of grants than smaller counties. Like rural counties have been left out maybe in that, since we had less capacity to apply for this first round of funding. I additionally am wondering if we need to have another conversation about the allotments for the tribal set aside and the rural county set aside in preparation for the RFP to go out. Like, because I know that we have like put in the temporary rules that we're going to determine those amounts, but they haven't been determined yet, right?
As far as I know, they have not been determined yet, correct?
Thank you, Dharma. Henry?
Yeah, good afternoon. I really appreciate all of the comments already stated regarding equity and making sure that when we're providing funding, that people are following through on the services that they're providing. One of the things that I'm concerned about is the idea that it is kind of confusing, because it seems like this is a new thing that we're trying to kind of invent. And so I look back at I was looking at the Senate Bill 755 as executive summary PDF that I think was it? Yeah, Wes sent us back in July. And that was kind of helpful just to look at that as a way to kind of maybe think more clearly about some of the things like minimum services and then minimum staffing. And so my concern regarding that is, that I think Dharma already expressed, some of the rural counties are not, and this is a thing that I would like to find out, and it talks about in that, in the Senate bill summary, is that each county, I guess we're supposed to require each county to have a burn. And so I'm not sure which counties so far have not been rewarded funding to develop a burn. I think that would be important to find out which counties. I don't believe so far that Hood River County has been provided or offered funding to create a burn. But I think it would be nice to have like a map that showed where there are no burns currently being funded, and maybe focus on that. And then also the piece around, culturally and linguistically specific regarding services. I strongly want to support the Latino community in rural communities being provided services that are culturally and linguistically specific. And oftentimes that means having certified alcohol and drug counselors, case managers, and addiction.
No, I will not look at her.
Addiction supports or wellness specialists that are both culturally knowledgeable and linguistically proficient. And so going back to a previous conversation, I think that we have a staffing issue around that. That we need to help motivate folks to get certified. And so I know that if we were going to try to stand up a burn in Hood River County, I can't find certified recovery mentors or CADCs to refer to that speak Spanish. So those are my concerns, and I really appreciate all the work we're doing, and it's nice to see everyone.
Thank you, Henry. Ron or Angela, did you want to respond?
I think it's very true that there's going to be a staffing issue, and we do need to find ways to get people with lived experience into positions doing this work. To that end, I am starting some conversations around expanding work assistance to folks who experience substance use issues. And hopefully we can increase the workforce, but I hear you. It's definitely a concern.
Thank you. Ron?
Right, just a couple of clarifications. So we haven't done any burn funding yet, and we won't be doing any burn funding until we do this next RFP. So second, right, and you mentioned the PowerPoint that Wes put out that it's kind of got a guide to the burns, and it talks about what those are. I think everybody has that. Then it's got in the very next page, it talks about access to care grants, which are increasing access to care beyond the scope of the burns all over the state, essentially is what it's saying. So once we have the burns, which is a specific set of services that we want to ensure are geographically placed, once that's the case, then we can move to increasing access to care, or we can continue increasing access to care. That's essentially what we just did, was increasing access to care grant. So I think I forgot my other point, but that's what I wanted to say right now. Thanks.
Thank you, Ron. Steve?
Yeah, thanks, Roberta. Maybe a couple of things to consider on the extension or not. First of all, I think what I've heard being discussed here are exactly the right things. The tensions between, continuing the next round of grants with providers when we don't have good feedback yet, and how the rushed initial grant process worked, I think are exactly the right things for this group to consider. And so one of the things that I would just offer up, if it's helpful for this body, to bring back the list of awardees from our last grants, so that this group can kind of reevaluate where those monies went. And I know Samantha Byers is on this call. We did request and actually require report outs from grantees, but that information is just now rolling in, understandably. These grants are brand new in the scheme of things, and so I don't think we yet have good data on outcomes, but we will. We required it. It's just early in the process. My concern is that in this environment, we are smack in the middle of a pandemic and a health crisis. And what I understand from Angela's laying out the timeline, we will not be well positioned to get both the burn grants out and access to care grants in a timely way so that we can assure the community continuity of care. To me, that's essential. I would also note that we've, up until recently, been in an environment of scarcity. We are no longer in that environment of scarcity. This body has access to really a very large funding source, and we've only used a very small portion of that in these initial grants, I think in the neighborhood of $20–30 million, when this body has access to $300 million. And so continuing the access to care grants that we have, provides that continuity of care for people who need it, and assurance to providers who brought on staff to be able to do this work with their communities, while this body determines how best to integrate the care that's associated with the burns through the next access to care grants. But bottom line, you can tell that in this environment, I'm very concerned about our community and that continuity of care. But whatever we can do at OHA to provide you the information you need to make a sound fiscal and community supportive decision, we'd be happy to bring that information forward.
Thank you, Steve. Sabrina, and then Blue.
Yes, I just had a quick question. When do we know when those last people that were funded are going to actually receive their funding?
I am not exactly sure, but Steve might have an idea.
Sorry, I'm having trouble getting my hand up or down. my apologies. I know we're actively working on it. We were talking through some of the last grantees who had not yet received it, and why not. We can bring that information to all of you next week. We'll commit to that.
Thank you.
Thanks, Steve. Blue?
So I hope I am not confusing things here, but if I'm hearing this right, and somebody just let me know if I am, any organization that applied for the last round of funding, if they are providing a service that would be one of the burn services, then they can apply when we open up the applications October 1st, which then could potentially give them continual funding, or not. They wouldn't have to worry about that lapse. Is that an accurate understanding?
I have a little bit of a different understanding. But my little bit of a different understanding is based on this conversation is that what I'm hearing is that we would primarily focus on burn funding for this next RFGP. And we do what we can to do extensions for the existing access to care grants with potentially considering a full increase to care RFP later. Is that on the table? That's what I'm hearing. I may be wrong about that.
I think that's still to be determined. I'm hearing a lot of folks say that they're interested in offering extension grants. I'm also hearing some folks say that there are equity concerns, but also desire for measurement of how these services have been rolled out and if they are effective or not.
Right, because we could for like a midpoint report, and then based on kind of what we're hearing, do some like investigation and outreach to find out if the services and programs are really effectively meeting the needs of the community, and then based on that, move forward, something like that.
I don't have the measurements that are required in front of me or in my head quite yet, but I know that there were certain requirements for certain reporting. And some of those reports will be coming in soon for organizations that still have not yet received grant funding. They're not going to be able to offer reports.
Right.
So it's a little limiting in the information that we get to assess whether or not people are doing what the grant requested them to do. So I put it to the OAC to determine how they want to do, if they want to offer those extension grants or if they want to go through an entirely new RFP process.
Thank you, Angela, for posing the question. Morgan, can I put you on the spot to share your chat?
Yeah, I'm just gonna read
comment?
it.
Thanks.
So I think, and it's true, I think we can preserve continuity and equity simultaneously, that these things are not mutually exclusive, because when we look at the total pot of money, the vast majority of what we're awarding will be awarded by future RFPs. And so we can uphold the value of equity while still maintaining continuity for services that are currently being provided in the community.
Okay. Thank you.
Zeb, do you have anything to say on that point? I saw that you agreed with Morgan in the chat.
Yeah, I was just going to say I 100% agree with Morgan on that. And also, there's going to be some more information coming out. Like, Steve mentioned there was some grant reporting that just happened. Then I was wondering, like, if there's any concerns about like existing awardees. Like, is there any way like the tri-chairs can meet with each individual awardee? I mean, is that too much time to ask? Like, if you guys have concerns about what agencies are doing or kind of want updates of what they're doing, it seemed like if the tri-chairs could like potentially like, touch base. I mean, like I said, that's a lot of potential work, but there can be something like that could ease concerns if there's agencies that aren't doing what they're supposed to be doing with the money.
Well, I agree with Steve that we're still pretty early in the process of what in terms of the funding we just allocated. And some folks haven't even received all their funding. And so, in terms of, I think might be a good exercise of as we begin the subcommittees as we launch the subcommittees to possibly investigate that as part of the work of the subcommittee. And report back, kind of where things stand, which organization, when were organizations funded with our money, where do they stand, how many organizations do we want to check in with us or report back at the midway point, and that can be developed in the subcommittee as part of that work. That would be my suggestion. Which takes us to the next place on the agenda.
That was a very
This is-
subtle nudge, Ron. Thank you. Yes, we're going to move on, but not before we hear from Onisha. Go ahead, Onisha.
I just have a real quick question. So it sounds like we're discussing two different things. So some of the organizations have got the money and some of them haven't. So the ones who have got the money, which may be a smaller number, I don't necessarily think it's I don't think people have to physically go out and see them, but maybe the chairs could set up a Zoom meeting or something with them just to do a verbal check-in to see how they're doing and do a report and ask them for a written report. But we keep glossing over two things. Like, yeah, there are some people, like one of our council members continues to ask about, there's concern that some people are still waiting for their actual funding to be received. But then we have some people who have received funding, who have hired people in these positions, and those particular people can give a report at this time. And so I think we should probably clarify those two issues instead of putting those two groups of people in the same position.
Thank you for raising that point, Onisha. All right, Angela, I don't see any
Roberta?
more hands. Yes,
Sorry.
Karen, go ahead.
Yeah, I don't have the hand thing because I'm on the phone, but I was going to ask if an analyst from the OHA who's getting the reports could provide us with a report. I'm hearing, I don't know, I have another full-time job. I'm not sure how much time I could actually dedicate to tracking down how people are doing and read a bunch of reports, but it seems like we do need to know that as council. We need to know who's gotten funding, who hasn't, just a simple breakdown, maybe a matrix or a table or something, and then who's submitted reports, is there anybody that hasn't, and then just a general summary of the reports about how people are doing with the funding and if their project's on track or not, and if they have any barriers or challenges that need to be addressed. And I would guess that workforce is one of those challenges if they do. So that would be my suggestion, is we have OHA and their analyst or whoever is getting the reports, provide us with some summary information.
Okay, great. Onisha says, thank you, Karen, in the chat. Not sure if you can see the chat. Keisha, go ahead. You have a hand?
So real quick, I just got a message that they are preparing the reports from the organizations who I guess did receive funding. And part of that was providing written reports back, and they're gathering that and they're going to get them to Angela, and which is who is going to get them to us, I guess, as soon as possible.
I will do that.
Thank you, Keisha.
Excellent. Thank you, Keisha. All right, robust conversation. More on this clearly to come.
Before we move on,
Go ahead.
the one point that I want to make sure happens is the development of a subcommittee to do this work. So if you have interest in this subcommittee, I'll drop my email address into the chat. Send me a message. Let me know if you're interested in doing this work so that we can get it going as quickly as possible.
Can we ask right now if there are people who are interested in participating?
All right, I see hands raised, so I'm gonna say that if you raise your hand, it means you're interested in participating. Let's do it that way.
Just to clarify really quick, if we are on the RFGP subcommittee, can we still be on the evaluation team, or is it one or another?
I'm sorry. And Sabrina, with that, I was just wondering what the conflict of interest policy was also.
Was that a question for me about the conflict of interest policy?
We don't necessarily want to put you on the spot for that, Angela. The group has talked about this in the past, and we have, I think the tri-chairs are trying to line up someone from OHA or DOJ to come in to talk to the group about conflicts potentially. And Allison the attorney, the DOJ attorney who is has been helping to support this group, has asked that folks submit their questions so that she can respond in writing. It's not necessarily ideal. This group likes to have discussion and share together. Keisha,
Yeah,
do you have anything
I'm
on that?
sorry. Yeah, we had discussed it. It just was, and it was kind of a point that Karen had brought up around she didn't really know if it was ethical to sit on the RFPG process if her organization was asking for funding. And we just never landed on if it is or isn't, or what we should do. And that would kind of lead to who can be on the subcommittee or not.
That's exactly right. Onisha, I see Margie's hand up. Go ahead, Margie.
I guess I was just going to say, we have had that question answered, and I believe Allison has put it in writing. So we do need to just pull that forward again for the group to review. And again, if we have anything that requires legal advice, we need to make sure that we're getting it from our DOJ attorney, and it does need to be formal and in writing so it can be posted for everyone. So we will follow up and either pull that document forward again for all of you to review. Please keep in mind, everything that we produce in writing is captured and saved to the site for us to reference at later date at any time. So just wanted to remind the group, all those things that Wes did, they still exist and we can go back and pull them forward. So thanks.
Thank you, Margie. Keisha, do you have more on that?
Yeah, I was just gonna say what Margie said, and us pulling the document back. I mean, we just form the subcommittees, and then whoever, after they read the document, can recuse themselves or not.
Sounds like a good plan.
I just wanted to mention, I only saw 3 hands go up, and just based on the amount of work, I would think that we would need like a minimum of 7 people, a minimum, from the council to be involved with it.
Do I see your hand up, Ron? Was that your way of
Yeah, my
raising?
hand's up. I mean, but I only saw three
Sabrina,
hands.
I see Sabrina's hand and yours, Ron. Blue, we got you.
Mine.
Keisha,
Dharma,
thank you.
Keisha. All right, good.
Great, Dharma, yes. And Zeb says would do it for sure if there's no conflict. Onisha's hand is also up.
Where's Caroline? I didn't see her hand go up.
Caroline's in that, she has another meeting until 3. So we might have to send a special request. All right, great. Sabrina, I'm gonna kick it back over to you to move us to the agenda.
Okay, awesome. Thank you very much.
Oh,
So
wait.
Ron is,
And Morgan, I don't want to not see Morgan. Morgan said, I will do it in the chat. Thank you, Morgan. All right, Sabrina, go ahead.
okay, Ron is going to lead us in a discussion about subcommittees for
I think
grant.
we did it.
You feel like we covered it?
The only thing I was going to cover was the language. Just we were asked by Allison to create a description of the composition and purpose of the subcommittee, and we basically have kind of a boilerplate that I shared with Angela, that Angela can share it at their convenience.
Okay, so then you feel it's safe that we move on to Colleen?
Sure.
Okay, then we're going to have Colleen Needham. She's here from OHA to talk to us about the next steps in the permanent rulemaking process in the Rules Advisory Committee, also known as the REX. Welcome, Colleen.
Thank you so much for having me again. I'm happy to talk about rules forever and ever and ever until you're all bored and send me away. So I have a few things that I think some of us mentioned that we are visual learners. I'm such a visual learner, and the rulemaking process is not simple. So I'm going to see if I can't share my screen with you all. Is that all right? Let me see what I can do here. Okay, I have a few things open and I'll try and make them bigger here.
All right, we can see your screen and I will monitor the chat and any hands, Colleen, for you.
Okay, thank you so much because I don't think I can see that.
No worries.
The first thing I just wanted to do, I know last time we talked about rulemaking And I sometimes like to do high level overviews again to just kind of have a context of where we are in the process. And this is a document that many of our rules coordinators at OHA and ODHS follow. And so I'll kind of start from the top and then tell you where we are right now and where we got to keep going. And then I have an exact timeline to share with you. So 2 documents that have more of our dates that Nita Kumar, one of our rules coordinators, that has created for you. So right now we have the very first thing we ever do in rulemaking is that preparation. And whether you're a new council or a very old rulemaking agency with the state, you say, we have rulemaking. And who do we contact? We contact our rules coordinator, and we often use the term rules writer. In that case, it's not an agency representative, it's the council, the tri-chairs representing them. And then of course, working with OHA staff, especially the rules team, to kind of say, did we outline it correctly? So you'll see this expression rules writer. A lot of times it means kind of like a policy analyst for the agency, but we're different in this circumstance. And then we go from here of let's meet a plan, which is the timeline we're going to run through. And me and Nita and 2 other ladies, Madison and Hannah, will help monitor and work with you guys on, is that we have draft rule text on the right and outreach. And I'm going to skip to this blue one, the draft rule text, because it points directly to the temporary, right? So this is the phase that we kind of already did. We drafted rule text. We sent to DOJ for review. That's Allison. She helped us, right? And we filed those temporary rules. That was the first step that we did. This is that process where we skip the public purview and the public comment period because we have to have rules in place right now, right? We had that September 1 date. So we jump to this. You'll see optional next to temporary because in the state of Oregon, it's not required that we do temporary rules. So we did those. And then you'll see it kind of has arrows back to notice filing, and then we come back to outreach. So our outreach is where we're at right now. We're kind of have a draft of the rule text that we like, that we filed with the temporary, and now we're kind of contemplating outreach. What do we do? And so we have a rules advisory committee, which correct me and tell me to slow down if I start using acronyms. The state's full of acronyms, so we often call it a RAC. And we can have public meetings, and oftentimes they're different. A rules advisory committee is usually set up of 7 to 9 individual people that represent the interests of those affected by the rule. So impacted by the rule. Sometimes 7 to 9 people is hard to come up with. They can represent entire regions, different poverty levels, different experiences, different ethnicities and races and history. So that's the one thing that we can go into a little bit more of how do we develop and make sure we're reaching out to an advisory committee, an advisory body of 7 to 9 people that represent it. That said, those 7 to 9 people are going to review the rule text, just like how you guys have done at the council meetings, going through line by line. And what they do is take the text that we developed and are continuing to develop and say, okay, that's what you guys came up with. Great ideas, council. That was just one body of perspective. Now we represent those being affected by the rules, those ones, you know, that are going to be impacted by what you've created here, and we have suggestions. Sometimes it's things like sentence structure. Doesn't make sense to me. Can it be clear? There's a phrase in rulemaking called plain language, and it's to make it to be as simple and well understood by as many of the population as we can, right? We try to avoid legalese and high fancy fluting words so that people who have to follow these rules don't really know how to read them. So it becomes difficult. So that's where we are in what we're doing is we're working on creating who might we invite to our advisory council, how much time we might need to review the rules with the advisory council, and making sure we have the text that we're ready to share with them. So that's kind of the real high overview of the next step of rule advisory committee. I'm going to keep going. I know we have questions about that, but just bear with me so we can kind of see the whole flow of the rulemaking first. Once we meet with the Rules Advisory Committee, we go through that text and we have an iteration that I like to say is kind of owned by the Rules Advisory Committee. And they present that back to to you all, to the council, and say, okay, this is what they came up with. Again, they are an advising body only. It doesn't mean that we have to take every suggestion they make. And sometimes you can't, because you might have two people on the advisory committee that say, for instance, if there was a fee, I want a $500 fee. We need to, make money and be able to fund other, grants. And somebody else who says, I want a $0 fee because I want as many people to be able to get this and apply as possible. Obviously, two advisory members have suggestions, but we can't do both of those things. So the council gets to come back just as you did for the temporary and kind of go, do we accept the changes that the advisory committee, the RAC, suggested, and we can say yes or no to each one of those. So we'll want to meet. And then just like we did with the temporary filing, we had that worksheet. There's a notice filing worksheet as well, one of the 3 that we'll do in our permanent process. And it has things about the fiscal impact of what is the fiscal impact to those impacted by the rules. We ask the advisory committee, but we also ask ourselves. And that, along with the text, goes in this next stage of notice filing. And the notice filing is kind of the biggest step in the permanent process that we do. And it's one of the bookends. And I kind of consider it the first bookend of the filings that we do with Secretary of State. And the notice says, hey, this is our proposed text. And I use the word proposed importantly, because it isn't lawful when we submit it to the Secretary of State. The notice is just saying we propose this. We're asking for you, general public and those interested, the RAC members, the council members, anybody to comment on it, our families. They don't even have to necessarily be impacted by the rule. They could just have public comment. And then we file it with Secretary of State to be in that Oregon Bulletin. And when we do that notice filing, it kicks off a bunch of dates and requirements, and there's a whole big book that we as rules coordinators follow and memorize, and that's our giant hat of rulemaking. So when we kick that off, all these comment periods kind of kick in. The thing that we get to at the very end is the final filing, which is the easiest step. We've gone through a temporary, we've gone through a RAC, we've gone through a notice filing. It's been public comment, legislative comment period, and now we're kind of done with everything. We as a council, or you as a council, will review the final language, double check with Allison and DOJ, and say, hey, we've got all the comments, we've incorporated them, and now we're filing the permanent. And it actually is the easiest filing because it literally has dates of when you want it to be effective, which in our case, I believe we want to go for January 1 or right around there, bearing the holiday, because I know lots of us don't work and want to be with family on January 1st. So we'll probably file it a few days before. And then we say, yeah, this is the law. This is it. We went through that public purview and here we are. And we have to do that even if we aren't hitting January 1, because we filed temporary rules, we got to do it before our temporaries expire, which I believe was February something. I need to double check our date, so don't quote me on that. So we have a little wiggle room, even if we were not to make January 1st. So that's the whole schedule, and I will make sure this gets sent out. I'll send this to Brandy to forward on to all of you. But I'm going to stop there. Did anybody have any questions on this kind of visual? And I went over another big highlight of the rulemaking. And I can't see the chat, so let me.
I got you. Blue, go ahead.
I just wanted some clarification. Since we as a council didn't get through all of the rules fully, will we at this point wait for the RAC recommendations and then work off of that, or will we be doing any work separately going through the rest of the temporary rules so that we can get to a place where we're okay? I hope that makes sense.
Yeah, it very much makes sense. The answer is yes, you'll definitely have time. I think what it is, as a council, you guys get to determine putting that on the agenda if you meet here and in this space, or to be able to talk about it. And again, up to you. You can finalize things. Want to talk to Allison and say, hey, is there any kind of, from a legal point of view, any edits that we need to make or thoughts we need to do? And then it kind of jumps ahead, but it's a great segue into, we have temporary rules that we absolutely have to adopt, right? But we also have these grants, right? Both the grant process, the access, forgive me, I'm not the content expert here on, but the burns and then the other access.
Access to care.
The access to care, thank you, Ron, that we need to have grants for. And usually when you have grants, you have the RFP process that Angela has been talking about, but you also have administrative roles. And so one of the things, 2 separate swim lanes, and this is what I was kind of talking to Allison before lunch about, is we have the role process that we're going through to take those temporary roles into permanents that we just went over in the visual here. But we probably have a few additional rules that we need to write related to those grants to kind of say, yes, we are doing this RFP process. Forgive me, see, too many acronyms in my head, to make sure that we've adopted them in role and to give a clear indication of, yes, this grant goes to this RFP. See, I'm doing it again. And it starts on October 1 and opening that up in role. And then if we have another one, we kind of talked about access to care being later. I'll help as you need help when we start to have that rule, but we might want to adopt more rules about that. And usually when we have grants, we have rules that go anywhere from eligibility, like what makes me eligible, and we write that in a rule. How do I apply? And then we have regulatory of, okay, if we apply to council/OHA, what happens to my application? How can I be sure that I'm the, I applied, and what are you doing with my application? And I feel like I was qualified and I didn't get it. Why didn't I get it? That kind of regulatory of 2 sides of it is, what is OHA doing with that application? And is there an appeal process? So sometimes you kind of have those 4 parts of a rule with a grant application, and whether or not we need 2 sets of them and all of them done, I'm going to find out for you. But I just wanted to kind of mention that because Blue, you kind of led right into that, what about other future rules that we might need?
Colleen, there's a question in the chat. Dharma, are you comfortable speaking to your question?
Yeah, it's just as far as the rack composition. I know that you mentioned like a 7 to 9 member rack. Is that just a standard, or is that like a requirement? With how big of a shift this is in our approach to policy, I'm wondering if we wouldn't need to have a bigger rack to encapsulate all the affected communities. But yeah, go ahead.
Yeah, that's a great question. So you're right. There's no policy or regulation required from our, we call it the APA, the Administrative Procedures Act in Oregon, that says we have to do 7 to 9. We can certainly open it up to more. One of the things to keep in mind as the council is that it's one of those, when I advise people creating racks, it's cooks in the kitchen kind of thing, is if you get 50 people, say, on your rack, you got to listen to 50 people give you great advice, but also have, and I'm going to speak frankly, have demands of the council of, I want this language, or I must have my sentence be formatted this way. And so sometimes you get too many people, it becomes hard to make edits. One of the great benefits of a rack in the before times when we could meet in person that I loved was that I would try as much as I could to have people in the room together. Which is hard because you want people from all over the state, right, to represent who's affected by the rule. But you would be able to kind of say, here's the text up on the screen. I'm ready to write. You guys tell me as a rack, how do you want this to be corrected? This was a lot of times, this is the agency's version, thinking when it's agency land, this time it's council version. What did we get wrong? Tell me how to correct it. And it's not just one person saying, write the sentence this way. It's everybody having these other side conversations with, them having to work together and have partnerships to kind of form. So it's when you're all done with a rack, you have this version of the text that's the rack's version. They had to come together and kind of make edits and suggestions together. So I am certainly open to more than 7 to 9 people and would work with all of you to kind of advise, and as the rules coordinating team would help you guys gather who you think should represent it and kind of come to a nice balance where it isn't 200 people where how would you edit text? So hopefully that answers your question.
Thank you, Colleen. Ron, go ahead.
Yeah, I kind of wanted to piggyback on what Blue was asking, but this is what I thought she was asking. Well, just in terms of the temporary rules, it was my understanding that we can reopen the discussions and modify and adjust the temporary rules at any time. And is that, I want to confirm that with you, that's your understanding.
Yes.
Okay.
Yeah, you have temporary rules and they're good until, again, I have to confirm, since I'm sharing my screen, I don't want to jump around and open other windows and confuse you and blind you with my crazy desktop.
Right.
But I think it's February 2nd or something that we.
Right, but I'm just saying, but between now and then, we can modify and adjust and change the temporary
As
rules.
much as you want, we just have to do paperwork.
Right, I just want to, bring that up. I didn't participate in the actual discussions, and so since I've been back, I've been able to look at the language, and I have a number of suggestions, and that where there needs to be additional clarifying language, or there's some technical and grammatical issues that I think at some point reopening the and having that discussion and completing the discussion would be a good idea. So I just wanted to make sure that we were able to do that.
Yeah, I might propose that as a council, you guys discuss when you'd want to do that. Is that the version, do you want to make corrections first and foremost and then present that to the RAC while you're discussing who should be on the RAC? Or do you want to keep that going in the background while the RAC is working on the version, you're continuing to work on the version, and then at the end, you come together to create your notice, which is the thing right here, the orangey colored one. Does that make sense? You have options. There's no wrong time for you as a council to amend your own text.
Right, but we can amend the text while does the text, once you establish the RAC, does that stop the process of amending the temporary rules?
No,
Okay.
not at all.
Right. Okay.
Yeah.
Thank you, Ron. Blue, go ahead.
Ron actually clarified what I was going to ask about, so I'm good. Thank you.
Thank you. Those are good questions. Okay. Do you mind if I share my second document? Are we ready?
Ron, is your hand back up?
Yes, it is.
Okay,
And it was
go ahead.
about and I think you might be about to talk about this as the outreach process.
Yeah, let's do it. So again, I'll share both of these documents with Brandy and whomever to disperse it. So just because I'm closing my window here doesn't mean we won't ever see it again. Okay, so this document is a little bit more confusing. It's Excel, so I apologize. It has a lot of information, but this is the one, if you're seeing, and hopefully you can kind of see it. I moved my cursor, but I don't know how well that translates. And I tried to make it as big as I could here on my screen. These are the ones that have dates on it. So when we do rulemaking, and that pretty chart that I looked at as we move from phases, there's the book that I refer to, the Administrative Procedures Act, that says that you have certain dates of which we have to abide by. Some stuff is wiggly, we have a range, and some stuff is you have to allow the public X many days. You have to allow the legislators in Oregon so many days to review. And so we can't get around that. And so when we come together and have that first meeting, so to speak, about rulemaking, and we say, hey, we got to do temporaries, but then we want to move them to permanent. What are our dates? What do we do when we make a timeline? And this is the timeline for your guys' rulemaking. And Nita put this together for you guys. And so the first question rules coordinators ask is, okay, you've got temporary rules, so you've already told me what date you absolutely have to have your rules effective before. And in this case, your temporary rules actually go beyond the date that you want. You want your rules effective on January 1st. So with all the requirements that rules coordinators have in our head about the things that we have to accomplish and deadlines we have to meet, we work from January 1st, 2022. I can't believe it's going to be 2022. And then we work backwards to say, where do we have to hit? And so it's our job as rules coordinators to help keep you on track so you don't have to be the ones to maintain all those dates and all the why. And then it's kind of a reciprocal process where in that last document I shared that, you know, you guys talk about, the council talks about who they want to be on the rack, and then we help, you know, schedule the rack and make sure you have materials and the forms to fill out. And then you guys work with them to edit the text. And then, so there's kind of this reciprocal where, you know, to help achieve filings, you guys will help edit the text. And then we take the text from you and submit it to Secretary of State. And so there's lots of hurry up and waiting. So I just kind of like to put both of those out there as kind of the process of what we do. So like I said, Nita made this up for you guys, and we're at the step 1, and you can see there's 15 steps. I hope you can see. Can folks see? Okay. Again, I'll email it out. It'll get emailed out. And then there's kind of, you'll see acronyms all over this because the term rules coordinator is a lot of letters, so it takes a lot of space to write it out. But generally, kind of like Angela shared, there are 2 documents. This is 2 different visuals of kind of the same information that we had before, only I didn't do the fancy Gantt chart. But so when we talk about what's next for us is the rack, like Ron was asking. And how do we do the makeup of that? Who do we invite? And this is as a rules coordinator where we rely on your expertise as the council and the people with the relationships out in the communities where we say, you know, who is impacted by these rules? Who do you want to reach out to? And, you know, you could start with making a giant list of organizations, institutions, people, connections, all together and say, okay, are these people all across Oregon? Are they only in Portland and Salem? Are they all poverty levels? Are they, you know, are we talking to everybody? That's where rules coordinators kind of step in and say, okay, what's your list? How many did you come up with? And then Ron laughs and says, we came up with 3,418 people. And I go, fantastic. I'm so glad so many people are so excited. And then we say, that's way too big for a rack. I don't think, Ron, you would really say that, but I was just kind of using you as an example. So thank you. But then we kind of, you know, decide, well, who can we have represented? And if we do have people that we've talked to about these rules in this program and the work that we're doing with the burns that have shown interest before, do they elevate to coming to the rack? Do they represent a group? Can they go back and talk to their tree, I like to say, of all the people they represent and other communities where they can kind of come and say, I speak for these 32 organizations or these 17 people. And so that way you're getting more representation than saying, I'm Colleen, I speak for Colleen. You know, I might have great input, but I'm not representing very many Oregonians. So something to think about in the groups, and this is up for discussion. So don't feel like this is the only time I'll talk to you about that or the only advice we can get. So yeah, we can form that. And then the other piece of it is, it's a courtesy, right? So they're advising us and we want to think about how they're doing a favor for us, right? They have other jobs, other lives, other things that they're doing. And so we want to say, like, you know, we're hoping to meet, you know, two meetings, 2 hours a piece. It's going to be digital because of, you know, the COVID and where we are now, likely. In the old days, you might have, and hopefully someday again, we might meet in person and you could offer snacks and coffee and things for them, a warm place if it's cold and rainy outside, to sit. And then you can kind of talk to them about the rules and you tell them, you know, we've asked you specifically to be here for this expertise. And so you talk to them and have that more personal invite. I like doing it more personally that way. And then say we were trying to achieve 7 to 9 people when we were actually struggling to get 7 to 9 people, you might actually extend who you invite out and say, okay, I only got 3 from the 7 to 9. So now who else do we off to? And because you guys are a council, you actually have the benefit of talking to each other and coming up with that list and who you might want to advise. Sometimes in agency land, we have one program analyst who says, oh my gosh, of my stakeholder population, who do I reach out to? Like, I am only one person. How do I know everyone? Sorry, really long-winded, so I apologize.
Blue has a question. Go ahead, Blue.
I just had a couple thoughts as Colleen was talking, and one was thinking about people who are possibly not connected to an organization and just individuals. I was wondering if there would be a way to compensate their time, and also if there would be a way to increase accessibility. So if people need help with like an internet connection, I don't know if like laptops can be loaned out, but just making sure that we're trying to be as equitable as possible, you know, and not just opening this up to people who have Wi-Fi and computers and things like that.
I think that's a great point. And yeah, definitely. We have ADA accommodations. We can have folks at OHA help with making sure that the meetings have, you know, we can have interpreters and things like that. I've never figured out how to get people access to internet besides suggesting other public places, but those public places might be closed. So that's a really, really great point and something for me to consider with all my roles teams. So thank you for that. I'm going to see how we can figure that out. The loaning laptops or making something more accessible. I know in the past, again, when we had meetings in person, we used to, OHA and DHS have district offices all over the state. And so one of the ways we could do it is say, you know, screen on us as the council, you know, talking about rules, but we could open up a screen in 4 different cities across the state and tell people, hey, from this region, drive to Prineville if you're from Central Oregon, and you can go into the district office and go sit with other people and watch the screen. And you don't have to have any access to anything, but you'd have to get to that place. Now we don't even have that option because we're not open in the same way because of COVID. So that's got me thinking. Thank you.
Thank you, Blue. Ron, go ahead.
Yeah, so I guess I was thinking of in terms of the you know, the part where we start naming names. That, you know, I was thinking of it in terms of like buckets, like, you know, youth organizations, rural organizations, metro, providers, government, advocacy, you know, gender minority. So is that a place to start? I mean, because
that's exactly right.
Okay, all right.
That's how my brain thinks too, but I try to be.
Okay.
Yeah.
Colleen, do you need this? Do you need this screen still up?
Oh no, is that okay with you guys? It's a lot of information with our dates, but.
And you said you'd be able to share this with Brandy,
Yeah.
so the group can have it. Okay, awesome. Thank you. Go ahead, Henry.
Did I turn it off just before?
Yes, you did.
Okay.
Thanks.
Yeah, I was just curious. I noticed in the chat, I think it might have been Brandy had suggested or provided some, there was, Dharma had made this statement about 7 to 9, maybe more. And then Brandy said that, you know, that community dialogue meetings might be a way of identifying folks that would be wanting to engage in the RAC. And so I don't know, you know, if OHA can help to facilitate that kind of community outreach. You know, I don't know what the process was to find all of the folks for, you know, the count for the OAC, but maybe there's some type of similar process we could do for the RACs. Thank you.
Thank you, Henry. Colleen, can you speak to that at all?
Yeah, I mean, to me, that makes perfect sense. And that would be kind of up to you guys, what you think for how you want to, like Ron called it, buckets, how you want to go about making sure that you have the representation that you want and how you go about it. There's no wrong way. So hopefully that answered your question, Henry.
Maybe I need to like make a motion or something. I don't know, you know, or put it back out to the council around how we want to identify individuals or invite individuals from the community to engage in the RACs. Is that something that OHA can help facilitate? Specifically, Brandy, you said the use of community dialogue meetings in the chat. Thank you.
Brandy, go ahead.
Sure. And sorry, I'm staying off camera. I'm feeling ill today. So Well, when I talked about community dialogues meetings, I was thinking about that as a way to engage the broader community in addition to Rex. I think, but what you said is interesting. I mean, it could be that, we have those meetings giving, the broader community the chance to participate and give input. And that might then also sort of inspire people to come forward and say, hey, I'd also like to be on a RAC. So that's fine. But whatever you all need, I can help with. So I'd be happy to, whatever you all decide.
Thank you, Brandy. And Steve dropped in the chat that OHA is happy to support the RAC in ways that are needed, in the ways that are needed. AON, go ahead.
I just want a reminder of the timeline for which we need the RAC, because I think that might shape some of our options for outreach for the RAC.
Yeah, let me look back at the calendar. Let's see. What day did we have to have?
That's like October 4th. Is that right?
Say for public comments, Oregon Bulletin was on 11. So we're trying to file in the Oregon Bulletin by November 1st. And so that means we need to have the RAC in October. And I like to invite people 2 weeks and have text for them 2 weeks before to give them time to review, prep, reserve that time, and then have conversations.
So under the general buckets that we've kind of already identified, would a process be where folks could email or submit names to the tri-chairs or to Angela so that they're all going to one place? And then we'll have like a compiled list that folks have provided from the council. And then we can move from there based on the buckets that people are submitting names under to make sure that we have kind of identified the rural, the youth, the metro, eastern, coastal, provider, government, and so on. I'm just trying to create a process where people start submitting names. Like,
yeah, what might be great, because you and I are both bucket thinkers, is can someone make a list of the buckets, and then that way it gives you as a council framework to say, okay, those are the buckets. I have a contact, I have a group, I have an institution, I have government that fits into this bucket. And then say Colleen Needham emails and says, hey, Brandy, I have a contact that goes in the government bucket, that I'd like to suggest. And then you guys at a council meeting, rather than having a giant brainstorming session to do that part, can do that separately. And then maybe Brandy, and sorry, I'm volunteering you, but that doesn't mean you necessarily, but someone could say, make a sheet that says, here's our 10 buckets and here's the suggestions we got. We didn't get anyone in this bucket, but we got tons of people in this bucket. So then you kind of have some kind of organization of either an entity or a singular person in each of the buckets. Would that help? That kind of organization to think about, and then you kind of just have a general layout from your buckets of the organizations that you see, because you could also discuss, because what I think might fit in one bucket, you might not. You might say, oh, that.
Right. People could also want all different types of buckets too.
Oh, that's Keisha's point in the chat. Keisha, do you want to speak to that? Keisha asks, did we agree on the buckets? Blue, go ahead.
Sorry, my service
go
is
ahead.
bad. Yeah, I was just trying to figure out if we agreed on all the different buckets, who's missing, who's most impacted, who should be on here, like what collaborations, kind of what Karen had brought up some time ago around CCOs and things like that. I just don't know if we came to a certain agreement.
No, we're kind of coming up with that list now.
Okay, Blue. And heads up, folks, we have about 5 minutes. Blue and then Dharma.
Well, I don't know I can't remember how the announcement was for this council, but I know that once members were chosen, it seemed like there were buckets listed under each person's name of sort of the category or type of work that they do. And I'm wondering if we can agree on buckets. It feels to me more equitable for us to also post on our website or be able to do outreach to recruit people who might be in this bucket category that we don't know, because I think that if we are just, volunteering people that we know, like we're really not being inclusive. And we really need to make sure that, anybody who wants their voice heard, even if they don't know any of the council members, can still have an opportunity to possibly be on the rack.
Thank you, Blue. Dharma?
This was an aside, just because we only have a few minutes left. I just wanted to pose and ask if we could get like some sort of online drive to start housing all of the OAC documents that would be more accessible than digging through emails each time. I think that'd be helpful for me, especially, working across devices, if that's something that OHA could provide for us. And then two, if we could add the temporary rules to the OAC website to make it more accessible for folks, since I couldn't seem to find it linked on our OAC website.
Thank you, Dharma. Henry?
So I'd like to further Blue's suggestion and Dharma's suggestion about outreach to the general public, that we maybe place some kind of notification on the OAC website regarding participation in the RAC.
Okay, thank you.
This is Karen. I'm sorry, I'm on the phone, so I keep trying to break
Go
in
ahead,
appropriately.
Karen. You don't need to apologize. Go ahead.
I agree with putting an announcement out that would advertise to anybody who is interested, who wants to be on the RAC. I agree with that. And as a council member, I've also had people directly contact me wanting to make sure that when the opportunity comes that they can be on the RAC. And of course, I've got a lot of contacts, but I also know there's a lot of other people in Oregon who may be interested, but there are some groups that I do want to make sure are on the RAC. And if we're saying that now, I'm not sure if that's the exercise we're doing now or if we're sending this to Brandy.
Go ahead, Brandy.
I would be willing to collect those names from folks. I've had I've also gotten some emails that have come in through the public comment process where people are interested in being on RAC. So I've already started a list of folks who are interested and be happy to continue to collect those from folks and just maintain the centralized list.
Perfect.
Great. Thank you.
All right, thank you. I'm going to send it back over to Sabrina to wrap us up. We're at 2 minutes left.
Okay.
Thank you, Colleen, for being here.
Thank you for letting me.
Okay, thank you everybody for your participation today. And as always, reach out to us if there's anything that you need. And on that note, if nobody has anything else, I just
want to make an addendum to your thing, which is that folks are reaching out to the tri-chairs, and kind of in the conversation we just had over last week, we just want to ask folks that when you reach out to the tri-chairs, reach out to all of us so that we're all getting the same information. It's kind of the...
And I just wanted to clarify something, because at the beginning of the opening of this council meeting, I thought I heard somebody say that you can reach out to the tri-chair you feel most comfortable with. So I think we're gonna have to just make sure that's in which approach is proper.
Whichever works best for you, I guess.
We talked here, a point of clarification, what we talked as a group in our tri-chair huddle was that the invitation was for folks to reach out to whomever they're comfortable with, knowing that that tri-chair would share it with the other tri-chairs.
Right, so that's the point I was making. Everybody, okay. All the tri-chairs are gonna get it anyway.
Right.
Okay, thank you for that clarity. And on that note, thank you everybody for your participation, and we look forward to seeing you sooner than later. Have a good day.
Thanks, everybody. Take care.
Thanks, folks.
Bye. Thank you, Dharma. Good to see you. Danielle, thank you for today. All right, Angela, sorry about that crash. Oh, horrible timing.